Federico, please.
Good afternoon to all, and to thank for invitation. Today I want to tell you about lengthening with ring fixator in adult. Ring fixator in adult is rarely indicated because it's not well tolerated by patient in some anatomical district and for problems regarding joint stiffness. A comparison between circular and monolateral fixator in limb lengthening is well explained in this slide. Which do you prefer? For me, in adult, indication for circular frame is limb lengthening, hair shortening with deformity, for example, in outcome polio or infection limb or infection. Limb length discrepancy due to non-union shortening and deformity after surgery and post-traumatic bone loss. For example, this case of geno recurvato due to polio in young men with male shortening, treated with Ilizarov device, proximal osteotomy, correction of deformity and lengthening, 6-mount X-ray, X-ray and the clinical control at 6 years. Or in this case, one young man shortening in outcome of severe osteomyelitis in pediatric age, treated with compatotomy and lengthening, radiological and clinical result at 1 year. This case, another case, young female with infected non-union and varus deformity with 4.5 centimeter shortening, treated with hardware removal, non-union site debridement, and application Ilizarov frame. Proximal corticotomy, deformity correction, and last control at 1 year and 2 months, and 2 year 4 months. Or this case, or infected non-union in open fracture gastilon 3B, treated with monolateral fixator after a plate and bone graft and a recurrent or infection, treated with X-fix with bone resection, proximal compatotomy and lengthening, and bone transport. Final X-ray after 1 year and a half. Or this case, young man with closer Schatzker 6 proximal tibial fracture, treated with plate, hardware removal, and 1 year and 8 months with varus deformity and shortening. Postoperative control after Ilizarov frame, correction on deformity and lengthening. Final result. Or application in post-traumatic bone loss is indicated in selected patient with without neurovascular problem. Like this case of severe bone loss, 21 centimeter, treated with bifocal lift technique, control during transport, final result and the end of the transport, control 1 year and 7 months after completed bone healing. In conclusion, in our experience, circular frame is easier for surgeon than for patient. There are very few indications, especially in leg length discrepancy associated with complex deformity and in post-traumatic bone loss, which extreme salvage procedure are allowed. Thank you for your attention.